If you're one of those who've experienced a loss of taste or smell in the last few months, you may have had coronavirus, as it's now been added to the official list of symptoms. Until today, the list only included a high temperature and a new continuous cough. The new guidance was set out by the chief medical officers of England, Scotland, Wales and Northern Ireland, although some doctors say that new symptoms should have been added weeks ago and hundreds of thousands of cases may have been missed and spread infection as a result. The total number of people who have died with coronavirus reported in the last 24 hours is 160, and the number is usually lower following the weekend. It means the official number of people across the UK who are known to have died with the virus is 34,796. Our medical correspondent, Fergus Walsh, reports.
We would spray some pepper spray into this hood, and if we could smell it, then the mask wasn't fitted properly.
Surgeon Sinan Barazi realised he'd lost his sense of smell when he was being fitted with personal protective equipment. He kept on working, and it was only days later, when he developed a fever, that he was swabbed and found to have coronavirus.
I couldn't smell it after 20-25 sprays. Clearly, if you're walking around unaware that you're COVID positive, then you're a potential source of spread of the virus. So I could have infected colleagues, I could have infected patients without knowing it.
Until today, the only coronavirus symptoms people in the UK were told to self-isolate with were a high temperature or a new and continuous cough. Now, loss of taste or smell have been added, but that's weeks after the World Health Organization included them as symptoms. The WHO also lists tiredness, aches and pains, sore throat, diarrhea, conjunctivitis, headache and skin rash as other possible warning signs. On the 1st of April, this symptoms app from King's College London found that 6 in 10 users who tested positive for COVID-19 had reported loss of smell or taste. Researchers say the UK has been slow to act and so missed a huge number of cases.
We're talking in excess of 100,000, maybe 200,000 cases. Would have been missed, would have been out there infecting other people, increasing the R value. And I think this has just made the problem worse, caused problems in care homes and hospitals that we regret we didn't act earlier.
Loss of smell, technical term anosmia, was added only after government scientists were sure it would help improve detection. How many cases of COVID-19 do you think have been missed as a result of not including this earlier on?
The important thing was to work out if this would add any sensitivity to the diagnostic cluster we were using, and the answer is it makes a small, very small difference, and we have therefore decided to do it.
Former Love Island star Rachel Fenton was another whose loss of taste and smell was her main symptom. A nurse, she later tested positive for COVID-19.
It was very difficult for me at the time because I didn't have anything to refer to. I didn't realise this was a symptom, and it was so severe. I could have literally drunk a cup of vinegar. The loss of taste and smell was so strong.
Adding loss of sense of smell as a key symptom should ensure fewer positive cases fall through the net. Crucial if the epidemic is to be brought under control. Fergus Walsh, BBC News.
Anyone in the UK aged 5 and over with symptoms of coronavirus can now have a test. The government's made the pledge, despite frequently failing to reach its current target of 100,000 tests a day. And as our health editor Hugh Pym reports, some key workers already eligible are facing long waits to get their results.
Getting tested for the virus. These key workers queuing today had booked online for swabs to be taken at a drive-through centre and were told the results from labs should be sent to them within 48 hours.
Very easy. We logged on yesterday only. We got the test today. There's hardly any cars there. Very, very efficient.
It was very easy to get an appointment. I didn't get much trouble to get that. I'm a carer, that's why.
Just picked a convenient time and that was it. We drove straight here.
But some, like Michael, have had long waits for results. He's been told it'll be at least 5 days.
If you're going to make testing a central part of how we deal with this virus, you've got to get it right. No questions, it has to be efficient and right. And it may be just me, and I don't want to be the one complaining, but from my point of view, it's been disappointing, and I still don't know the results.
The Health Secretary Matt Hancock set a target of 100,000 tests a day by the end of April. Since then, the number provided has dipped below that and has only been back above 100,000 on some days since. That total includes home testing kits sent out to those who request them, rather than those returned to the labs.
Today, Mr. Speaker,
The Health Secretary said he wanted to increase the overall number of tests.
Every day we're creating more capacity, and that means more people can be tested and the virus has fewer places to hide. Today, I can announce to the House that everyone aged 5 and over with symptoms is now eligible for a test.
But Labour said getting results back quickly was the priority.
On tracing, I have long argued that the safe way to transition out of lockdown is by having a test, trace and isolation strategy in place, but it depends on quick turnaround of test results.
Slowing any future spread of the virus will depend both on testing and tracing recent contacts of anyone who tests positive. Contact tracers have been recruited to phone, text or email people who patients say they've met recently. That's 21,000 new staff in England. A new app will also be alerting people if they've been with anyone with symptoms. They're then told to self-isolate. The app's being tried out on the Isle of Wight. It's set to be rolled out across England. Devolved administrations are considering whether to use it. Contact tracers are ready to start work. Ministers said the whole system would be up and running by the middle of this month, but it's still a work in progress.
Well, Hugh's with me now. And Hugh, there's some criticism tonight from the head of NHS providers about the government's approach to testing.
Yes, Fiona, NHS Providers represents trusts in England, and Chris Hobson has said the testing setup is a patchwork quilt with too many gaps. He says there should be a lot more priority for NHS staff and patients. We shouldn't forget that capacity has been built up a lot since early February. It was 2,000 a day. It's now 130,000 a day. Contact tracers in England, 21,000. The original target was 18,000, and many said that was too ambitious. But the app is still not ready to be fully launched across England. More amendments are needed. That might be a couple of weeks away. There are still delays, with some people having to wait a while to get their test results back. And all this, of course, is very important, because until a vaccine or drugs are developed, this testing and tracing and tracking is really the main weapon to try to keep the virus in check. And Professor Jonathan Van-Tam, Deputy Chief Medical Officer for England, said at the briefing the virus could be with us for many months to come, if not years, and could well pick up in the autumn and winter.
Okay, Hugh, thank you.